Council is urged to grasp chance for change. Policy should focus on people, not systems, say charities. Charities and other groups that work with the disabled are urging Shropshire Council to grasp its current review of adult social change as an opportunity to implement changes that will move away from traditional models of service to more client-based and cost-effective methods. If the Council's proposals focus on services rather than on clients, they will miss the point, says members of the Shropshire VCS Pan Disability Forum. If personalisation is to be meaningful, it must focus on outcomes rather than means. One issue of concern is the possibility of charging the disabled and elderly for use of day centres. Whatever the rights and wrongs of charging may be, the Pan Disability Forum and other groups believe the move will distract attention from more fundamental concerns about personalisation. Forum members are encouraging the Council to take this rare opportunity to be more innovative and widen the discussion. Among other things, they would like to see it include clients and their support services. They point out that experience in pilot schemes in other parts of the country demonstrate that the long-term savings from people living happier, healthier, more fulfilled lives has already proved to be significant, as are the savings made in medical and care demands, which are reduced substantially. They urge a move away from reliance on services, with service users being encouraged to expect truly outcome-focused holistic care packages that enable them to live a quality life, optimising their personal wealth in terms of family, friends, community and activities. One Pan Disability Forum member said that to do this there would need to be careful consideration of how to explain to users what the options are and to enable them to understand the wider range of choices that they might make. Clients should be helped to understand what their rights are and be able to articulate their views and challenge if they feel they are being underserved with information or misinformed. Experience elsewhere in England showed that to do this effectively would include a retraining programme to ensure that social workers doing assessments and social care staff supporting them are all working to the same objective, a better life for the individual. Working in this way would still create opportunities for financial savings and would also lessen the impact of the cuts. Longer-term savings would include fewer demands on the care system and wider engagement with other stakeholders who would support people in their own communities. Individual needs will be met, say the Council. The report to Shropshire Council's Cabinet says that the implementation of personalisation will ensure that individual needs are met in a tailored and individual way. It will mean charges for users of council day centres. To make this possible, all users will have to accept personal budgets, which are central to the personalisation policies. The Council's argument for charging is that personal budgets have proved successful and are increasingly popular with service users. That Shropshire is in a minority is not charging day centre users, that charging will be more fair and for all users, that there are currently inconsistencies in charging and contributions, and that the present economic climate makes it necessary. The report says the extension of the fairer charging policy will bring in higher income, which will be ploughed back into services. Savings linked to in-house day services are likely to be, next year, 2012 to 13, £250,000, in 2013 to 14, £750,000, and in 2014 to 15, £950,000. SDM believes that if personalisation is implemented in the most holistic way, there will be big savings in health and welfare terms, not just cost. Don't miss your chance to speak your mind during the consultation. For details of consultation events, call the Council 0345 678 9000 at local rate, or you can go to Live Life Your Way page on its website. The link is www.shropshire.gov.uk/adult carer. Whatever you do, have your say.